Dr. Josh here with Patient Mastery. So my team saw this question from a chiropractor on Facebook, which most likely you can relate to, and that's the whole understanding of how long does treatment take when most likely you're only with a patient for a few minutes. It's very common for a chiropractor, your visit's under 10 minutes, yours might be under 5 minutes, yours might be under 3 minutes, to each their own. But from a patient standpoint, just like this patient wrote, hey, $75 for 6 minutes, cancel the rest of my appointments. How do you best respond if you're given the chance, like ask in person or at the front desk, rather than thinking you have to do the 45-minute recommendations, hour-long lay lecture that their spouse has to come to, and all of this stuff that just makes most chiropractors feel like they're pushing a boulder up a hill, not want to be in practice. And when your energy lowers, patient energy lowers, new patients lower, and things just don't go as right. That's what's magical about Patient Mastery, is we show you how you could drop 80% of the education, use patient-centered communication that shows patients the difference in their life care is gonna make, and it makes paying you easier, referring to you easier, staying with your recommendations, and considering you the doc for life. I'm gonna share with you one example of a really simple and easy line to use that patients can totally understand. It's from the medical paradigm, so immediately there's more prestige and efficacy and authority, and it works. You know, just last week in our weekly training in Patient Mastery, we did a whole session on quick one-liners for getting patients to understand frequently asked questions that they have. So it may be, hey, why are you adjusting there if the pain's down here? Or like this one, how come the doctor only spends 2 minutes with me? There's a lot of them. And we had a whole brainstorm session and created a document so you can use them rather than thinking the Merck chart is the answer or the disc and spine model. Listen, that goes so far, but as soon as you get into physiology and anatomy with a normal layperson human being, it goes right over their head. So the more you can use examples that they can totally understand and relate to, the more you connect. In this example, here's what I recommend saying. They asked that question like, hey, is that it? It was only 90 seconds with you. The adjustment only took 20 seconds or 3 minutes, whatever it is. And say, hey, have you ever gotten a vaccine or a shot before? Now, it doesn't matter what your viewpoints or if you're not endorsing vaccines, that's regardless. You're just using it as an example that everyone understands. Have you ever gotten a vaccine or a shot before? Yeah. How long did it last? And they'll say, well, you know, a year or life. I don't know, tetanus. Okay. How long did it take for that injection to go into your arm? Light bulb goes on. It took about 4 seconds, much shorter than the time you spent with them, and the results were lasting. Now you can also use that same analogy and example when someone says, hey doc, why are you adjusting up here if the pain's down there? Well, have you ever gotten an injection or a shot? Where did it affect? Did it affect your immune system? Did it affect your whole body? But where was it placed? Just right there on the shoulder. But it wasn't just impacting right here. Connect to something they can understand, something that has high authority, relate it to exactly what you're doing, and it makes practice so much easier and connecting with your patients. Take it, run with it. If you are stuck in the model of thinking you've got to overeducate, do 45-minute recommendations rather than 5 minutes that you'd be proud if your mother sat through, having to bring a spouse for an orientation every week, and then you don't get to have dinner once a week with your family or get your kids to bed. If you're stuck in any of those paradigms, you're most likely, your collections are stuck. And if your collections are stuck, your profits are going down over time because practice overhead goes up, inflation goes up. If you're looking for help to be the go-to doc in your community, get paid what you want to get paid and deserve for helping people get back to their life, and have more time off without compromising your income, we can help you. Go to patientmastery.com, check out my new book, all the training videos, speak to a coach inside PM who's helping docs all day long, give you insights on your practice of what you can start, what you can stop to get to your next level. Keep helping people get well. Thank you for all you do.